For Essay 3, you will be turning in an outline and a final draft. I went ahead and produced a video and an outline just to give you some ideas how you might want to look at this. It is due April 16th. So I chose a topic about adopting socialized medicine. I then included a thesis statement. Now you'll notice as you look at this, I focused on the cost. The increasing cost of healthcare spending climbing from 3.8 trillion in 2019 to 6.2 trillion in 2028, giving an argument for why we might adopt a socialized medicine model. So I focused most specifically on the cost area. You could focus on other issues as far as healthcare inequality, money, many elements, in terms of social issues, but I wanted to do it from a thing that was clear with a lot of research and numbers. So if I have to include an introduction, I need to kind of talk about why is healthcare so expensive. So you can talk about the fact that we have private health insurance of many kinds, government programs like Medicare and Medicaid. There are people that are uninsured who go to emergency rooms for care rather than visiting a doctor. Thanks to changes in the laws, prescription drugs can be marketed directly to the public, and we certainly see evidence of that everywhere. Because we have so many insurance options, this leads to higher administrative costs. And then I pulled in some information that the cost of administering healthcare billing is 31% of the total, and in Canada it is half that. So clearly we've added a higher level of administration that also drives up the cost. So I've talked about several things that could be driving the cost of healthcare in the United States. So as you talk about supporting idea one, it's good to think about what would be your strongest argument. You want to lead with something that is very specific, important, more so than maybe what you might include in supporting idea 2 or 3. So I talked about, or I have included some ideas that I might want to write about. What drives increasing healthcare costs? Well, we have an aging population and a growing level of chronic diseases. Direct marketing of pharmaceuticals adds to the costs, and we do have a variety of insurance options. And so I went in and pulled in some research on healthcare premiums, whether you have an employer-paid or a self-paid plan. Employer plans went from about 15,500, and I have an extra number in there, in 2015 to about 21,000 in 2020. So whether you pay that or not, the employer is still paying a large portion of that cost that is increasing quite dramatically. If you're looking at the unsubsidized ACA plans, those increased 97% in 5 years, from 8,700-ish to 17,000 some. So you can see that there's a lot of different drivers of the increasing costs, but I've definitely included a number of possibilities here. Now, I may want to limit this in my final paper. Certainly, I might want to look at it from the angle of aging population and level of chronic disease. But you can certainly play around with that. Just come up with some options so that you do have a few possibilities to explore more specifically. So once you include something there, you want to include a quote or citation. It certainly doesn't hurt to include statistics like I have in this outline. So moving on to the supporting idea 2. So I looked at, because I introduced the idea of Medicare and Medicaid in the introduction, that's going to be my supporting idea 2. So I pulled in some data that supports that the sickest 5% of the population consumes 50% of all healthcare costs. That's a pretty big number. Obviously, most of those patients are older and on Medicare. If you contrast that to the healthiest 50% of the population, they only consume 3% of the healthcare costs. So that's a huge dichotomy in the numbers. And then I also looked at what the cost of Medicare spending in the last year of life is, 6 times greater, and for those that do not die. So Obviously, Medicare is a huge driver of these costs. Now, what I didn't include was costs for Medicaid recipients. I could go back and add that. Um, the reason I included Medicare only at this time was that there were some pretty startling numbers there. And I can detail that much further. But certainly you can explore including that. So if I go down to supporting idea 3, I had talked about the uninsured population in my introduction. So I want to bring that idea forward and talk about the costs of assisting the uninsured in emergency room visits. So I would want to go and pull some numbers, including how much hospitals write off in costs that they cannot recover, or things sent to collections. And I also want to look into how this adds to the cost of operating a hospital or clinic. Who is the cost ultimately passed on to? So, and we know from having our own insurance that the costs eventually add up in our own billings. So, but notice I'm really focusing very specifically on the financial aspects of this. I'm not getting into greater societal issues. So then you're going to also include a quote or citation, and maybe this is where I put some of those costs. Okay. So my opposing viewpoint. Now you can certainly add more than 3 to 5 sentences. Mine is a little bit bigger because I want to talk about socialized medicine would involve paying a known premium through taxation without surprise medical billing. So I'm talking about a benefit of socialized medicine. It would help to eliminate medical bankruptcy and encourage people to seek care when needed, not waiting. The cost of pharmaceuticals is better controlled in countries like Canada. And in fact, I can pull up the data on this, but Americans now often buy drugs from Canada at third the cost charged here. So that's another thing that could be a benefit of socialized medicine. But I also want to talk about what that change would mean in terms of how our model would shift. So you can't talk about the benefits without at least highlighting that in other socialized medicine countries, there are long waiting times for procedures, sometimes 6 months to a year in Europe for knee replacements. So there is a trade-off to making that choice. You may not be able to get care immediately, and in some horrible cases, people die waiting for care. So again, these could be numbers I pull in. It's also unclear how the cost of prescription drugs would change here. Big Pharma has a fairly sizable lobby, and Congress certainly listens to the people that spend money. So that, I don't know how much we would benefit, but that would certainly be some data I could pull in for that. And then finally, the cost of the private health insurance industry going out of business is a huge societal and unemployment cost. People would definitely lose their jobs. The government would have to add these functions, allowing for some new options, but that would be a huge disruption of the market. So I don't know that we know enough at this time to make a really solid choice here. And that's what I'm going to talk about in my conclusion. So switching to socialized medicine would be worth evaluating because right now we are in a cost spiral with healthcare and insurance. But I'm also advocating for an in-depth analysis of the cost-benefit trade-off. And that's not being currently studied adequately. There is some analysis, but I don't think we have clear enough data on what this change would mean. So I also provide some suggestions or ideas about seeking input from patients, doctors, hospitals, and other healthcare providers across the population. So clearly this needs to be studied more carefully with a lot of public input. And then I finally say at an end, socialized medicine is an option. There may be other changes that can introduce to the system to limit the growth and provide better care and savings. So you notice I don't have a really definite conclusion to this one. It's a very complex topic and certainly one that needs to be studied further before one can come down on one side or the other. So I wanted to show you that just so that you had the idea that you don't have to have a definite yes or no conclusion. In some cases, it may be a topic that also requires further study, which is fine. You can be somewhat indefinite as long as you provide some suggestions as to what could be done. So, and then notice I also included some work citations here for the sources I included in 4, 5, 6, and 7. So that's what Mrs. Sipple will want to see when you turn your outline in, just so she can give you feedback on what you need to either change or maybe research a little bit further.